I think the problem is that we don't necessarily have drugs for a lot of these targets, and so I think IDH is the best one that we've seen. It's prevalent in patients with more advanced myelofibrosis and people who transformed to AML from myelofibrosis. And we have two FDA-approved inhibitors for IDH1 and IDH2. So there is a clinical trial coming down the line for combination ruxolitinib and IDH2. So that's an MPN Research Consortium trial. I think we have to wait and see what happens, but there is actually already data that targeting IDH2 in patients who've transformed to AML from MPN can actually have efficacy, right? So there is some proof there. Now, the other mutations are tricky, and do we have great drugs for the other high-risk mutations? No. I mean, how do we target RAS? That's a whole different discussion, right? Splicing factor mutations are being investigated, and there are concepts that are actually now in clinical trials to target those. So that might be the next thing we see, particularly since they seem to be associated with a poor prognosis in general.